Hey, it's Kevin Henry, the editor-in-chief for drbicuspid.com. I'm sitting here with one of the KOLs, those key opinion leaders when it comes to infection control, and one of my go-tos whenever it's infection control questions pop up, and that's Leslie Canham. Hey, Leslie, how are you today?
I'm great, Kevin. Thanks for having me.
I get to hang out with you. It's a good day. I'm really glad about that.
Yeah.
Hey, let's talk about dental unit water lines, okay? Why are we still worried about testing whenever we know we're treating the water?
Well, how do you know if what you're treating is working? So if you test, then you can verify whether you're within normal limits of safe drinking water, which is 500 colony-forming units of heterotrophic bacteria per milliliter. And that's what water agencies say is safe to drink. So our dental unit water should be as safe as drinking water.
And why aren't we doing more testing? Why aren't we doing more treating? Is it because we're scared of what we're going to find out from those numbers?
Well, that could be, but the reason that we're seeing more testing taking place is that there's been some outbreaks due to dental unit water line that has affected individuals, particularly children, and the outbreaks that have happened over the last about handful of years. So if you're testing and you're treating your water, you have more confidence that you're delivering safe care to people. Okay. And if you're not testing, of course, you can't know your numbers.
So what are some of those cases out there that maybe you're aware of that maybe dental practices don't hear about, but they need to know the ramifications of what's happening?
In Jonesboro, Georgia, there was a pediatric dental clinic where children were starting to get sick after they had dental treatment. Well, it was kind of a mystery as to how they got sick and what the common denominator was. And it was discovered that these children had pulpotomies. So this is an invasive procedure. And it was also discovered that the dental unit water was contaminated with non-tubercular mycobacterium. So now we have eyes on what's happening with dental unit water. A year later, we had the same event occur right here in Southern California at the Children's Dental Group, where more than 73 children actually were made sick as a result of being exposed to contaminated dental unit water.
Wow. And that should be a warning, I think, for all dental practices that think maybe this will never happen here or whatever, but it's important for them to know it does happen.
It does happen. And so careful and responsible dentists will follow CDC guidelines. While their state dental board may not require them to test and treat their dental unit water, I can tell you from experience that when it comes to court, a jury will look at whether a dentist had followed the best practices in infection control, CDC guidelines or their state dental board regulations, or even manufacturer's directions, which provide information on how to maintain your dental unit water lines.
We know those dentists rely on their team members to make sure that happens. With the new wave of dental team members that are coming in that don't have a lot of experience in dentistry, how do we make sure they're up to date and knowledgeable about infection control standards?
Well, it takes time to train, and it takes a little bit of knowledge and some experience to make sure that you're doing things the right way. OSAP, the Organization for Safety, Asepsis, and Prevention, is a wonderful place to start with someone that has little training and no formal, let's say, dental assisting experience behind them. Making sure that people are aware of that they have to read manufacturer's directions for everything that they use. And, that's a funny thing is that we don't always see manufacturer's directions being followed when it comes to infection control. And so people wonder why are we having problems? And we didn't do things right.
It's like reading that instruction manual from IKEA whenever we're trying to put a table together, right?
Right.
We just think, well, we can do it ourselves. Is that the biggest mistake that you see with infection control out there, is just people not reading the IFUs?
That's right, Kevin. I think that people are training other individuals, maybe a dental assistant that's departing is going to train the replacement. And they train with not the best practices and not following manufacturer's directions. They train on the way they've always done it. So if we're looking at the manufacturer's directions, we can see maybe we're missing something. And the person that trained us wasn't aware of that.
And I know one of the things that is a buzz out here in Southern California is the Fast Check 15 that has come out from Solomedics. I know silver ion technology is a part of that. Can you walk me through silver ion versus iodine and kind of what's the difference and why one is more beneficial than another, maybe?
Well, Kevin, when it comes to iodine, it's possible that a patient may taste the iodine in their dental unit water. It's also a little bit different on the manufacturer's directions for maintaining it. With the silver ion technology, I like that you get a little bit more time between having to shock and do something like a biocidal agent that might be ultra liquid that's run through the lines. So I think from a convenience standpoint for people who are in charge of maintaining their dental unit water lines, that it would be more convenient to use a product that has silver ion.
What's one of the biggest things that you hope as we get into the second half of the year in 2025 that you maybe see changing with infection controls in the practice? What's a resolution you might have as one of those experts out there? What would you like to see?
Taking infection control seriously, empowering someone in the practice besides the doctor. The doctor is busy enough. And if they're not producing dentistry, they're not able to stay in business very long. Doctors don't have eyes in the back of their head. So we need to delegate to a responsible individual in the practice, which is hard because we have a shortage of workforce in dentistry all around the nation. But if we could take one person and empower them with knowledge, skills, and the tools that they need, not only the information and the education, but giving them some communication skills so they can have courageous conversations about infection control with their team and they can lead the team. They have to do it in a way that the team will follow. So, a little bit of finessing there.
And is it up to the team member to really say, I need this, we need this as a practice in order to keep our patients safe? Should the team member be a little more, shall we say, forceful with the dentist to make sure that they have the right training?
Yeah, team members oftentimes bring to the dentist an area in infection control that is not compliant. And so again, the dentists don't always know what's happening under their own roof. When it comes to instrument processing, you can't see sterile. When it comes to disinfecting treatment rooms, you can't see disinfected. You can see clean, you can see dirty. And when it comes to dental unit water lines, you can't tell what the bacterial colonies are. So we need to make sure that we have the systems and the protocols in place, the procedures in place. And if we have somebody whose eyes on those procedures, dedicate one person to make sure that we're doing things the right way, that we're washing our hands long enough, that we're following the right protocol for treating water or for decontaminating treatment rooms, then we are able to put a little bit more assurances on we are compliant, we're safe, we have confidence.
One thing that I'm hearing a lot about right now is the rise of the infection control coordinator. How important is a role like that to a dental practice, in your opinion?
Extremely important. And if we hear oftentimes that, well, nobody has volunteered to take that position. Sometimes people have to be voluntold. I've been voluntold multiple times.
I like
and
that.
It just means that we need to dedicate the time to allow that person to gain the knowledge, attending OSAP meetings or spending time reviewing the website and looking at for example, dental unit waterline protocols in the white paper there. So when someone has the tools that they need, and then we have the time to allow them to do that, and I think probably most important is that we need to have that person be comfortable in coming to their coworker or to their supervisor or employer and saying, there's a gap, there's something that we're not doing that we should be doing. Yeah. And then the team, the coworker, the doctor who they are approaching needs to be approachable. They need to thank that person for bringing it to their attention.
I know you're a big believer in OSAP, and obviously I am too. And I love that there are trusted sources out there for infection control, because so often I see dental team members will go on Facebook and ask each other for opinions. And that's where I think OSAP and reading those IFUs becomes even more valuable rather than getting your knowledge from social media.
That's right. I see that too, and I sort of lurk on those channels, and sometimes I see things and answers that not right.
Well, Leslie, I'm thankful that you're around and that you have the Divas podcast.
Yes.
That is very awesome. There's so many great ways out there to get infection control information, especially with dental unit water lines. So thank you for all you do. I appreciate that.
My pleasure.